Sore gums can hijack your day. Coffee stings, flossing bleeds, and worry sets in. Try a gentler routine that protects the gum line, keeps saliva flowing, and fits a busy life. You are not falling apart. Most of the time, your gums are just reacting to a daily pattern that can cause irritation. When the routine is gentle and consistent, gums usually settle down, and your mouth feels clean without drama, as they should. This information is education only, and not medical advice. Talk to your dentist or clinician for personal guidance. Why do gums get fussy as we get older? Plaque builds a little faster when days are busy and sleep gets short. Saliva may be lower if you take common medications or sip coffee all afternoon. Mouth breathing from stuffy sinuses can dry the tissue. Stress can tighten your jaw and make you brush harder than you realize. The fix is not to attack your mouth with harder scrubbing. It is to protect it. Keep plaque soft, let friendly bacteria live, and give the tissue time to heal between irritations. Your aim is simple. Keep the gum line clean without scratching it. Keep saliva flowing. Keep snacks from bathing the mouth in sugar all day. Use tools that feel kind and repeatable. If a tool feels like sandpaper or alcohol on a cut, it will not last. Gentle wins in gum care the same way gentle wins with sore shoulders and knees. Start your morning routine with a very soft brush and a pea of fluoride paste. Hold the brush so the bristles point toward the edge where the tooth meets the gum, not straight at the tooth. Use tiny circles and a light touch. Think polishing, not scrubbing. Spend about 2 minutes and cover every surface. When you finish, spit the extra paste and do not rinse with water right away, so a little fluoride can stick around. Clean your tongue with a few easy swipes. If you floss in the morning, glide the floss gently along the side of each tooth and hug the curve near the gum. If floss is hard to handle, a water flosser or small interdental brush can reach the same spots with less frustration. Pick the tool you will actually use. During the day, treat water like a quiet mouthwash. A few sips after meals and snacks wash away food and give saliva what it needs to do its job. Chew a piece of sugar-free gum with xylitol for a few minutes after lunch if your jaw is comfortable with it. That lifts saliva and gives friendly bacteria something they can handle. If you love fruit or yogurt, choose whole fruit and unsweetened yogurt and keep both with your meal, not as constant grazing. The number of sugar hits per day matters as much as the size of the treat. Night is the anchor routine. Brush with the same light circles and soft bristles, then clean between teeth with floss, a water flosser, or interdental brushes that fit your gaps without forcing them. Take your time at the back teeth and the little triangles near the gums. Rinse with a simple salt water mix if your dentist says it is okay. If you prefer mouthwash, choose one that is alcohol-free and gentle. Daily harsh antiseptics can knock down friendly bacteria, along with the troublemakers, and leave the tissue drier. Aim for a moist, balanced mouth, not a completely sterile one. Add 2 small safeguards that protect tender gums without extra effort. First, use a light grip so you cannot bear down. Hold the brush with pressure from 2 fingers and thumb primarily, and replace every 3 months or when bristles start to bend. Second, follow an acid timing rule. After citrus, soda, wine, or vinegar-heavy meals, rinse with water. Wait about 30 minutes before brushing so soft enamel isn't brushed away. If cold or sweet still stings after a week, try a gentle fluoride toothpaste for sensitivity and speak with your dentist. If your mouth feels dry at night, a bedside humidifier can help, as can a glass of water within reach. Practice nasal breathing during the day. Simple nasal rinse before bed can open things up if your nose feels stuffy. Some people use nasal strips at night. Speak with your clinician before you try mouth tape or any device that changes breathing. If you suspect you grind your teeth, ask your dentist about a night guard that fits your bite. Protecting the enamel makes brushing more comfortable, because you are not scrubbing sensitive edges to make up for wear. Bleeding that shows up the first few days of better cleaning can be a normal sign that your gums are irritated or being cleaned for the first time in a while. Bleeding that keeps going for a week or gets worse is a signal to see a professional. A professional cleaning lifts hardened tartar in places a brush cannot reach. After a cleaning, your home routine will feel easier and your results will come faster. Aim for regular checkups. They are not a luxury, are part of the pattern that keeps small problems small. Food choices support gum comfort more than most people think. Protein helps tissue repair. Vitamin C from peppers, berries, and citrus supports collagen. Leafy greens carry minerals your mouth needs. Cheese or unsweetened dairy and calcium-fortified plant milks can help buffer acid after meals. Crunchy vegetables scrub lightly while you chew, but sticky candies, constant mints, and frequent sweets keep acids high. Place sweets with meals when you do have them instead of spacing them out through the day. If you use nicotine, which no one should, know that it not only yellows teeth, but also dries and tightens gum tissue and slows healing. If you are open to change, ask your clinician for help with a plan that fits you. Hydration is basic but real. Saliva is your natural defense, and it is mostly water. Keep a bottle in your line of sight and drink throughout the day. If medications give you dry mouth, talk to your dentist about saliva, supporting gels or lozenges that are sugar-free. Xylitol lozenges can be a good fit for some people. Try one at a time and see how your mouth feels the next morning. Add a mealtime finisher that protects your mouth. And lunch and dinner with a few bites of something crunchy and low sugar like carrots or celery. Then sip water or unsweet green tea. Green tea's natural compounds can help calm bacteria and freshen breath without sting. If dairy agrees with you, a small piece of cheese after meals helps buffer acids. Again, keep sweets minimal and with meals, not between meals, so your mouth spends fewer hours in an acid bath. Stress and sleep shape gum comfort in quiet ways. When stress is high, people clench their teeth, breathe shallow, and rush brushing. Give yourself some calming time in the afternoon to slow your breath. Inhale for a slow count of 4, hold for 4, exhale for 4, hold for 4, and repeat a few cycles. At night, dim the lights an hour before bed and put the phone face down after dinner. Better sleep helps saliva and lowers the urge to snack late. Calmer nervous system leads to a calmer mouth. Travel can knock routines off the table. Pack a very soft travel brush, a small tube of paste, and a simple floss pick set. If you like a water flosser, a small battery-powered unit can live in your bag. Airplane air is dry, so drink water and chew sugar-free gum when the seatbelt sign is off. Hotel breakfasts often lean sweet. Add eggs or yogurt next to the pastry and eat the protein first. A few wise choices keep your mouth from starting a fire you have to put out when you get home. Here's what improvement usually feels like. Brushing stops stinging. The pink you saw on floss fades over a few mornings. Cold water feels normal again. Your mouth tastes clean when you wake up because you did not snack late, and you did not go to bed with a heavy sauce on your teeth. The routine feels boring in a good way. Boring is the feeling of tissue that is no longer irritated. Run a simple 7-day trial. Each morning, use the soft brush with the gentle angle at the gum line, and take your time. Each midday, drink water and chew a piece of sugar-free gum, if it agrees with you. To recap, each night brush, clean between teeth, and use a gentle rinse or salt water if your clinician says it is fine. Keep sweets with dinner instead of as solo snacks. Keep lights low before bed and sleep in a cool, dark room. Write one line in your notes app or calendar each day about how your mouth felt that morning. Patterns stand out fast when you pay attention. If something still feels off, do not push through the pain. Continued sharp pain, swelling, pus, a foul taste, or loose teeth need a professional exam. Gum health is a team sport. Your daily routine is the base. Your hygienist and dentist handle the heavy lifts you cannot reach on your own. That partnership gives you the best odds of calm tissue and a strong bite for the long haul. If you want something that supports gum comfort and matches this plan for gum care improvement, I put a link to an option that I recommend in the description below. It is designed to help support a healthy oral environment as part of a consistent routine. Remember, though, that supplements of any kind are not a cure-all. Brushing, cleaning between teeth, food timing, sleep, and hydration carry most of the load. Thanks for watching, folks, and make sure to hit that subscribe button if you like what you saw here.